I'm Tracy, called Tracy Tokuingwa. I'm the Health Communications Advisor at Arthritis New Zealand. Gail trained as a physiotherapist and discovered her love of hand therapy during a decade spent working in the burns and plastics unit at Hutt Hospital. Following a stint as a clinical researcher at Wellington School of Medicine, Gail completed her master's degree in physiotherapy. Gail is currently focused on completing her PhD and researching the merits of using silicone oil for hand exercises. And we've got Lisa. Lisa graduated in 2000 from the University of Queensland with a Bachelor of Occupational Therapy. She has over 20 years experience in hand therapy, working in London, Sydney and Brisbane before deciding to hop across the ditch for a new challenge, commencing work with Wellhand in May 2018. Lisa has a keen interest in treating complex wrist injuries and flexor tendons and has completed research on the treatment of mid-carpal instability. So both of these ladies bring a wealth of experience and knowledge to share with you tonight.
So as Tracy introduced, Lisa and I both work here at Wellhand, which is a specialist hand rehabilitation centre based in Wellington. So tonight we're going to go through and talk about what hand therapists are, what the symptoms of arthritis are, and that actually you guys obviously know that a lot better than we do, but we'll talk about exercises that you can do that may be of assistance, splints, or sometimes they're called orthoses, that may be useful. And then we're going to go through some of the concepts behind joint protection and how you can look after and get the best out of your arthritic joints, including the use of assistive devices. Then we'll look at how you can, if you need to, find a hand therapist in New Zealand. So what is a hand therapist? Because we use that term. It's either an occupational therapist or a physiotherapist who's completed additional postgraduate training. And so we have specialised in the assessment and treatment of a whole range of hand injuries and disorders. And the commonest ones include, obviously, arthritis, but there's other disorders such as dupuytrens and peripheral nerve conditions, as well as all the trauma and accidents that happen to people's hands.
So how are your hands affected by arthritis? So these are the symptoms that people are usually coming in talking about, or definitely the ones that you guys are probably feeling. Pain, that's the key. What can we do about helping the pain? That's usually caused by some inflammation. So different types of arthritis can have different presentations. So different joints are affected with rheumatoid arthritis, different joints are affected with osteoarthritis. So rheumatoid is usually the smaller joints in the wrist, so the knuckles and the wrist joints, and osteoarthritis is the weight-bearing joints. So the base of the thumb is quite common, and the ends of the fingers for gripping and loading. So pain is something that we can talk about when someone comes to see us. Swelling, so joints can be really swollen, they can be inflamed, hot to touch, or they can be aching. Loss of joint range of motion or stiffness is really common. People find they can't move them as well as they used to. This can lead to a bit of weakness in their grip and reduced ability to use your hands in self-care or leisure tasks or just daily life tasks. This is just a picture, just as an example of base of thumb arthritis. It's very common, myself included. We have a little bit of pain in the base of your thumb. So if you can see that x-ray there, or is it reversed on your screen? But I'm looking at it and it's on the left of my screen that there's a hyperextension deformity, and the base of thumb is where it's all sort of coming from. So that joint at the base of the thumb is a saddle joint, and in the picture on the right hand side it's sort of looking subluxed, and the picture on the left we've got a bit of a knock-on effect with the middle joint of the thumb. So those sort of things are important to find out, and we can really do something about helping to protect those joints by splinting and realigning the forces that are going through the base of the thumb. So swelling, pain, loss of motion, weakness of grip, all that sort of stuff. So pain management, what can we do about that? We'll go through them all individually. Okay, so pain and swelling management. There's lots you can do on this, but really what I was talking about before with hot, red, swollen joints, that's telling you it needs a bit of ice or an ice compress or a cold pack. If it's really inflamed, hot to touch, it needs to cool down. So ice packs. If it's more of an achy sort of a pain, we usually try heat. Heat can really help to loosen up the joints and help the stiffness ease out. So try some heat. Sometimes if you've got a really inflamed, swollen joint, the actual contrast of warm and cool can be quite good to get the circulation kicking in and move that swelling. Massage is really good. Hand therapists are quite good at massage. So massage of your hands, some of the muscles of your hands can become quite tight, and this can have a knock-on effect on tightening up and stiffening the joints. And then you can see a nice picture there of some compression gloves that can really help, particularly in this sort of weather, keep your hands warm, and hopefully that then helps with a little bit of reduce of swelling and movement.
So the next thing to think about when we're dealing with stiffness in the hand is how do we get the most out of the joints of our hand? And I like to think about the analogy of tires on a car. So if you think about the amount of load that goes through the tires on a car, that affects how quickly the tires wear out. And so does the alignment of your wheels. So if everything's out of alignment, your joints are going to wear more quickly. So one of the most effective ways of maintaining movement in the hand is to put all of the joints and the tendons that drive your fingers through a full range of motion. So in this slide, you can see the 4 different positions that put the hand through a full range of motion. I want you to think about doing this exercise with the least force possible, like it's a Tai Chi exercise, so that it should start with the fingers extended, gently coming into the hook position, relaxing into the palm of your hand, and then folding the tips, and then coming back out. And repeating this exercise around 5 times is a great way to loosen up all of the joints of your hand, but it's also the ideal way to maintain as much motion as you can. So that's for range of motion. The other important role of exercise is to gain stability. And this is particularly important in pain that affects the base of the thumb. So here, there's 2 components to this exercise. It's where you're attempting to very lightly touch your index finger to your thumb and creating a large C motion. So we don't want an oval like a squashed egg, but a nice big wide C position. And then very lightly, the second position, once you achieve that position, now try to lightly touch your thumb to your middle and index finger. So you form a nice round circle. Then you gently compress and feel the contraction of the big muscle at the base of your thumb. This position helps slot the bone right down into the base of the saddle joint. So this particular splint we're looking at here with the thumb helps slot that bone into ideal alignment. And so this is going to achieve better wear on the joint. These splints are available and can be purchased from a hand therapist, but they come in multiple different sizes, so do need to be fitted so that they work effectively. Or they can be custom made to fit a person's hand, depending on what the therapist thinks is going to be best to create stability. There's a large variety of wrist splints available. We custom make them, and we also use different off-the-shelf products. We make ones out of soft material. We can make ones out of rigid plastic, But the whole design behind the splint is to support the joint and reduce the load that is going through the joint. If we reduce the load, we reduce pain, and that then means we get a better life out of that joint. So these are some of the options that we can do for finger joints, where we can either use rigid plastics or soft neoprene, and we custom make them to support the joints. When instability occurs, that's where the ligaments are no longer holding a joint in a stable position. We can use splints to regain that stability for performing activity.
Okay, so now we're going to discuss some joint protection principles. Some of you might have heard about these already. So we just talked about maintaining the movements in the joints to lubricate them. So that's really important to help to protect the life of the joint. So if they're healthy moving joints, they're very well lubricated and they can last longer. So movement obviously should be slow and gentle. So you don't want to put a lot of load or force. So like Gail was talking about, just nice and easy, not lots of power. We also want to reduce excessive load on the joint. So we're talking about some of the splints can really help to distribute the force. And a really good idea is respecting pain. So if you're doing something causing a lot of pain, don't try and push it when you're already in pain. That would then lead to potentially tissue damage. Or is there another way around that by protecting your joints with a splint? And then you can do a little bit more, avoiding staying in one position for long periods of time. So that can really come across as stiffness. You can really feel some stiffness, even a stiff neck from typing some people get. So what we're talking about with the hands is changing activity quite often. So about every 20 minutes, half an hour, change and move your hand. Just do some of those gentle exercises to get things going, get the blood flowing again. And the last point there is avoiding repetitive tasks that involve the same action. So yeah, break up your day, try and do a couple of things, change things. Don't sit there and do the same thing all the time. So another example, if you're vacuuming your house, try not to do the whole house in one sitting. Do a couple of rooms, have a break, move your hands, and then go again. So the next slide about increasing function. So this is a quite cool little picture holding a cheetah. Is it a cheetah? So holding the joint in place.
Really heavy.
Yeah, so there's less pain during load. So really looking after the joints and protecting them. And the second picture there, I quite like it. You can see on the tip joints, there's probably quite a lot of force and stress going through the end of the finger. So trying to take the load off that. So everyone's probably heard of a jar opener or may even have a few at home. They're brilliant. So devices and aids helping to generate and transmit the forces so the joints have less stress. So here's another example, assistive devices. This is a key turner. I don't know if anyone's seen one of those before, but the principle is just taking the load off the index and the thumb joint by distributing the force through using the whole hand to turn the key in the lock. So there's lots of different tips and devices that we can problem solve with you. So if you've got a problem and something that's always causing pain, come and chat to a hand therapist and say, okay, every time I do this, it hurts. What can we do about that? And we might have an example of an assistive device. We might talk to you about protecting that joint with a splint. Really think about what load and stress goes through your hands. So you can see some of the pictures there. We're trying to find solutions so you can keep doing what you really love to do. We don't want you to stop. We want you to be able to do it with less pain and less stress. This is how you can see a hand therapist. So HTNZ is Hand Therapy New Zealand, and it's a website and it has a list of all the hand therapists in New Zealand. And you can mostly book online. You can phone a hand therapy practice like Wellhand. Unfortunately, ACC doesn't cover arthritis. It's not an injury. So there is usually a consultation fee and maybe a cost for splints or things that we might be talking about. Some private health insurance, though, do cover consultation and splint costs. So that's quite useful to know. Maybe you can look at what level of cover you have. Then we've got just a bit of a summary. So problems that you have, pain and swelling, what can the hand therapist do? Talk about heat or ice therapy, give you some compression, so some gloves or some Cobands, another really cool little compressive bandage that you can use for finger joints. We can sew up lycra sleeves, we use neoprene sleeves, these are on the other slide. Splinting can help to reduce some pain and swelling. So how do we work on stiffness of joints? Gentle exercises in the right way to help to regain motion. That motion as lotion is a really good thing, like a really good take-home message, I think. What else we can do? Protecting joints from damage. Splints again, anything that's going to help support the joint and transmit the load. And working on some of those stabilizing exercises Gail was talking about. So how can we stabilize our wrist joint? How can we stabilize our thumb joint? Giving you the muscle strength to be able to load a little bit more. Loss of function. So giving you those aids and tips and devices that can help to increase your independence by being able to do more by yourself. So opening your jar, using your jar opener rather than giving it to your partner. Working on weaknesses. Obviously, we're all about exercise and strength. So that's what we do. That's our bread and butter. So increasing your strength without placing stress on the joints is the key.
Yeah, so thank you. The one other probably little thing I might add would be when I've done previous presentations, often there's been a representative from the mobility centre who are based in Lower Hutt. And they have a fantastic website that you can find all sorts of equipment that is really helpful and ergonomic for hands. So big wide potato peelers, spring-loaded scissors, the key turners that Lisa talked about. There's just a whole range of stuff available on their website. So that's the Mobility Centre. So you can Google them. Tracy, I think we're over to you.
Thank you, ladies. And on that note about the Mobility Centre, we have them on our website, as well as a few assistive devices that we currently carry and other assistive device stores around New Zealand and online. You'll be able to see our stuff and a bunch of external places like Elite Left, which is left-handed specifically.
I'm a lefty.
Are you?
Absolutely. I really struggle with my thumb pain because most scissors do not, they're not adapted for left-handers. So having spring-loaded scissors is just so good for my hands.
All right, so let's get into the questions that we have. So how do we get help with trigger finger in the thumb from Paula?
Trigger finger is where there is an issue with the glide of the tendon running through the sheath. And that's really common in arthritis because it's the synovium that becomes inflamed, and synovium lines joints, but it also lines the tendon sheaths. And triggering in the thumb can be managed generally really efficiently with a little splint that is molded and put onto the back of your thumb, and we Velcro it on, and you basically can wear that splint for probably 6 to 8 weeks, maybe sometimes longer, and it can be probably, I'm putting a figure out there, it's probably about 80% effective at settling down triggering in the thumb. And then the next after that, it's heading into a steroid injection or a surgical consultation. But we can generally have really good results with splinting.
Cool, thank you. And following on from that, from Te Reapi, what is splinting?
A splint is something that is an external support that is put on or around a joint. So when you break your arm and you're put in a plaster of Paris or a fiberglass cast, we would call that a splint. And there's all different sorts of splints that can be...
This is a thumb splint, for example. So we've molded that out of a type of material that's heat sensitive, and it's molded to fit a particular thumb, not mine actually, but somebody's thumb. Okay. And then, for example, this is a wrist splint or a wrist orthosis, if you want to call it. So that's molded onto someone's wrist, and then the Velcro straps attach it to your hand and keep it on.
And this plastic is great if you're having to, wash dishes. It can get wet. Or if you're bathing children or anything, it can get wet. Whereas some of the other, neoprene or wetsuiting or soft splints, you know, get dirty really quickly.
Gail says her compression gloves are a godsend, but only one of her fingers always loses feeling. So would a larger size glove still have the same supportive effect?
Yes, that's very interesting, because the diameter of your finger changes when you have arthritis. You know, your joints get bigger. So it's highly likely that that one finger is too tight. And so
These are really good gloves. And I did mention these are the really good IMAC gloves. They're really good for arthritis. People love them.
so if one finger is too tight, you could potentially use your scissors and just snip a little down the seam of that finger.
The other thing you could do is, if one finger particularly was more swollen than the others, you could use this as Coban, so compression wrap. It's got stretch in it. You don't want to go too tight or it will cut off your circulation. But if I was, let's say I was doing this on Gail's finger, we want to, that's a bit too big for you, Gail. Do your middle finger? No, have you not?
Big finger.
I'll cut it.
Cut it, yeah.
So it's just it's like a hug. Literally, it's like a hug for your joint to really support that joint.
And it's very, very light. It's
Light
made from
and
paper with shirring elastic in it, and it just feels so nice on your finger.
And then it seals there, and you can wear that and it can still move. And then you can take it on and off like a little bit of a sock off, and then put it back on again. As long as you don't scrunch it up, it's, you know, you could use that for a week even.
So yeah. And we actually use this a lot with athletes who injure their fingers, you know, cricket players, hockey players, when they've dislocations, when they have lots of bruising and swelling. And this is an ideal way to manage it. And you can actually, because it's paper, you can actually get it wet. You can put it in water and just gently dry it and leave it on your finger, and it turns into literally a nice soft paper mache support for your finger.
Can you get that material anywhere else other than hand therapists?
Yes, it can be bought from the pharmacy. Some supermarkets stock it. It's called Coban, C-O-B-A-N. And yeah, a lot of, a pharmacy may have it. I mean,
you can have it in different sizes as well. So there's different sizes. Some might be this big and then this big and then this big. So yeah, depending on how long your fingers are.
Awesome. And Lisa, you mentioned the glove, IMAC glove. What is that? It's a brand?
Brand.
It's the brand.
That's great,
Yeah.
thanks.
And they're marketed as an arthritis glove.
Yeah, that's the one that I had on, and I think it's the one in the picture as well. My mother has arthritis. She loves these. I've got a little bit of base of thumb arthritis. Yeah, these are good.
And how would they compare to something from the warehouse or something online from like Temu or something?
If you're getting something that the purpose is to provide compression, then yeah, you may find something similar, but I doubt whether it's going to be quite as effective. These are highly researched fabric materials that they're made out of that have a 4-way stretch in them, so they give an even compressive force.
So it might be a trial and error. Yeah.
You can Google online and find arthritis compression glove, and you probably get a whole, I don't know, there's probably hundreds of different brands around the world that you could find.
And Nikki says her thumb sometimes locks up. It's very painful and she has to use her other hand to unlock it. Any helpful ideas?
Excellent. We've just talked about that. That's likely to be a triggering in the flexor tendon of her thumb. And yes, it's incredibly painful when it jams down and you have to unlock it. Yeah, really sore. So yeah, the splinting protocol that we talked about is very effective for that.
And what are your thoughts on strength training? Pauline says this has been great for her back, but she's starting to get issues with her thumb joint and she has wrist problems too.
So strength training is...
Does that work for hand joints?
Well, yes, so that's the stabilization and stability exercises we were talking about. So strength and conditioning generally for an athlete is looking at toning specific muscles that are going to provide the best support to those joints that you're moving across. So for instance, with squats are all about your hip stability, which is incredibly important for a lot of athletes. So when I showed earlier the stability exercise, it's one example of doing a stability exercise for the base of the thumb. And then there are other ones that we can use like TheraBand or different isometric exercise, which is where you are contracting your muscle strongly, but you're not putting the joint through a range of motion, so that you're actually holding firmly and pushing hard against a resistance, but no movement is occurring, but you're generating really good strength in the muscle. And those are ideal things to be doing for arthritic joints, but not at the time when the joint is in a really acute hot flare. So when that's occurring, that's when we've got to kind of button everything back and respect that the joint needs more rest than exercise. And that's that kind of really difficult balancing act.
One person says they're in their 30s and they work in a daycare, constantly picking children up, changing nappies, etc. So wearing splints isn't ideal as they constantly have to wash their hands. What could they do to protect their thumb-based joints?
That's quite a common thing that we see. Lots of young mums picking up kids and changing nappies get base of thumb pain. So it depends whether it is a diagnosis of arthritis, and if it is, we want to protect the joint. So there are some neoprene sort of options so that can get wet instead of hard, rigid thermoplastic. But yeah, we'd want to be doing some strengthening and try and get out of the splints as soon as possible. So what I would do is wear the splints for a short, quick, fast time and get you out and get you moving and get you under control without having to rely on the splints the whole time. So it's teaching people how to use their hands a little bit differently and take the load off the thumb.
And I think one of the things that lifting and handling children is that ideally we don't want to be using this side of our hand, our thumbs and our index fingers. The power in our hands comes from our little finger side. If I'm picking up a heavy object, say this is my baby, I'm wanting to make sure I'm gripping with my ring and little fingers. So when you're reaching under a child to pick up a child, you're reaching in and then you're rotating in so that you're using these sides, not pinching. And when you're then rotating off so that the weight is then going onto your forearm, because we've all got nice strong bicep muscles. We're not trying to lift the weight with our thumbs and fingers. Transfer the weight onto your big muscles and then onto your core.
And Ellen asks, you talked about jar openers, and we do get this quite a lot as well, and we find that different jar openers work for different people. But are there any particular ones that you find with your clients that work better than others?
Not really. Everyone usually has a favorite they bring in and show us, but there's not one that I would swear by, if you like. We sometimes just use non-slip matting to try that out first, like a non-slip mat that you can use underneath your jar so you can get a better grip on top, or flip it over and use it on top of the jar. That's usually quite cheap to start with, so you don't want to spend a lot of money if you can find a really quick solution that's a lot cheaper.
Personally, the one that I have liked, it's actually like a triangle shape with teeth inside it. It gets screwed under your bench top, and it will take from the widest point to the narrowest point. So you've got one item that's out of sight, just tucked in under the bench, that you literally, if you've got your jar or anything that you're trying to open, then you slide under the bench and it just notches into the teeth, and then you can hold with two hands and rotate it. But you do need someone to screw that in under the bench for you.
Helen asks about her finger joint that she dislocated. So she's asked what will help: exercise, cortisone, or joint replacement?
It's a continuum.
Yeah.
I don't see it as one more than another. I see it more that trying to get the best possible function and life, like the tires on the car, the best possible life you can get out of that joint before you're then defaulting to joint surgeries. And they're inevitable in some situations, and they're the best solution. But what we try to do is maximize what you can get out of the joint beforehand. And certainly I believe some people have their finger joints respond extremely well to cortisone injections and settle all the symptoms down, and then they can get, you know, another year, another 18 months. You know, I had one gentleman who loves playing bridge, but the thumb pain from holding his cards was dreadful. And so with the use of a splint and a steroid injection, it changed his life, and now he's five years down the track and still hasn't gone back for the joint replacement that was suggested as the only solution. So yeah, everyone's different.
Thanks. And Debbie asks, do you think hand surgery with fusion of joints is worth it long term? She has psoriatic arthritis.
I think if you're very disabled, you can't actually do what you want to do, and if you're dominating pain, you can't get rid of the pain, and the surgeon's offering something that can take that away for you so that you can then function and live your life, then yeah, I think it's probably worth it. How much life then you put through that joint, so you want to really protect it while it's healing and make sure it's a really good result from the surgery. Then there's obviously definitely exercises to do to make sure that it's nice and stable. That's the key. Once they do the replacement, you want to then stabilize the muscles supporting it, and that can then help to prolong the life of the joint replacement as well.
So a joint fusion is the default surgery when there's not a lot of bone stock available to be able to do a joint replacement, and that pain is the dominating feature. And that's a very personal decision, but certainly they can be game changers for people. If you can take away pain, then wow, that's amazing.
So Jane asks, is grinding of the joints easy to stop?
So I think the term we're talking about is crepitus.
Crepitus,
Yes? Yeah. I'm assuming this is not clicking or locking or just the general joint symptoms. If we're getting to the point where you have joint crepitus, that means you've really lost a lot of the cartilage in that joint. And so that's where minimizing load and really trying to align the joint earlier is ideal. You want to be able to do those things before you get to the point of having significant joint crepitus.
Grace asks, is playing the piano okay for people with arthritic hands?
Yes.
Absolutely. Yes, absolutely. Yes.
Yes.
Please. Yes, we want you to.
Do what you love. It's really important, and it's how you approach doing that activity. Don't go and play a 3-hour concerto or whatever it is you're playing on the piano. It's a little bit and often, and you know, you're getting, if you're spanning an octave, that's great stretch. And you know, even doing scales is just such good work and movement for your fingers with not a significant amount of load. I think it's a wonderful activity for sore hands.
Trisha asks, what can you do for dupuytrens in my little finger?
Dupuytrens is not arthritis.
Not arthritis.
Dupuytrens is a disease of the connective tissue of your hand. Yeah, and it will kink your fingers in and down. And internationally, the gold standard for management of dupuytrens is surgery to excise the dupuytrens tissue, which often can end up needing a skin graft. But that's a whole other topic.
She said she has arthritis as well, so yeah.
Yeah, that's a complicated hand.
Okay, Karen says she has newly diagnosed arthritis in her hands. Only the left hand is really bothering her at this stage, but no doubt the other hand will get worse over time. Her biggest issue is pain with cold weather. Is she best to get compression gloves or look for something warmer like merino or something in fingerless gloves?
Try what you really like first. I mean, if you're trying something really with the cold weather now, I'd be going for some merino, but these compression gloves should have an element of warmth to them as well, and they do when you put them on your hands. So if you're getting a really nicely fitting merino glove, that can be similar to a compression glove, but if you really have a swollen joint, you probably want to go with more compression than just the merino.
Cool. And Caroline asked about supplements. So what are your thoughts on
You
taking
can answer that,
Yes.
Tracy.
I can
You're the
answer this.
listener, not us.
I can answer that. So she's asking about curcumin turmeric to reduce pain in finger joints. So in terms of reducing pain, the evidence is out on having supplements. I do recommend, if you do want to use turmeric as an anti-inflammatory food in your diet, which I definitely recommend, I try and eat turmeric every single day, is just to include it with your food. And if you are including it, make sure you use black pepper because it increases the bioavailability of the curcumin, which is the active compound in turmeric, for us humans, because you can eat it and you can really only absorb a small amount if there's no black pepper there. So there's a little compound in black pepper that helps with that. And some people do find that adding turmeric to their diet as part of a whole healthy eating plan does help. Supplements, some people do swear by the supplements as well. It might work for you, but the evidence is out on it helping a lot with pain. It's more of an anti-inflammatory. Nikki said she has had a lot of prednisone over the years and the skin on her hands has become fragile. Any tips?
Yeah, that definitely is a side effect of a lot of prednisone. Your skin becomes fragile. So you know how there's a term osteoporosis where the bones become fragile. There is a term that's now being used in dermatology circles about dermoporosis, where the skin loses the layer of fat underneath and becomes very prone to tearing. General skincare principles then become paramount. Being really aware that extremes of hot and cold aren't great for fragile skin. Clearly, any shearing forces, things sliding across the skin, are not good for them. Just the awareness of always checking sharp objects, general skincare, and keeping the skin well moisturized gives you another layer of protection and helps reduce shear forces. So there's a lot, there's silicone barrier creams that have been shown to be effective for reducing shear forces on fragile skin.
Celia says she's 37 years old. She's wondering how much attention she should be paying to assisted devices for her age for long-term prevention of damage to her joints. Is it just when she feels she needs it or before she needs it? And she's currently wearing splints on both hands for carpal tunnel.
I think if there's something that you're doing repetitively that you then are feeling pain due to that activity, that's when you want to sort of think, okay, how can I do this activity differently? So yeah, protect the joint by maybe using an assistive device or a splint while doing that activity. Yeah, that's what I would try and do. Yeah, I don't think you need to go to a shop and get everything you need. It's about problem solving what
you do most.
Yeah, what you do most and what you need to reduce that pain.
And what are the best tricks for cycling?
Cycling, actually, that's really interesting because we see a lot of cyclists who have trauma, like they come flying off their mountain bikes and break their wrists and things. And the setup of the bike, now I'm not a cyclist, but the setup of the bike is really, really important so that there is not significant weight bearing going down through your hands. So if you're someone who loves cycling and you spend hours out on your bike, it's really worthwhile going to a really good cycle shop that knows how to set up the bike so that the weight is distributed down through your core and you're not leaning too heavily and weight bearing down through your hands. Your wrist joints and your thumb joints are not designed to be weight bearing. Your feet are, but not your hands. So I would say start with the setup of the bike, making sure that the brakes and the gear changes, the resistance on them is not too high. So that's really good maintenance once again, and that they're not having to force and stretch too far, that the settings are that you can get your braking and your gear changing happening without excessive load. And if need be, for some people, a wee thumb splint, you know, that can be custom made. You can mold the plastic to take into account the handlebars. I've done that for someone who was doing the coast to coast and had problems, you know, because it's such a long period of time on the bike.
Do you know the Murphy splint, and is it good for psoriatic arthritis?
I'll go and grab one. Hang on.
So I think in our presentation, we had a version, a plastic version of a Murphy ring,
This is
which is an overlaid.
overlay.
And the Murphy splint is actually when you have very specific measurements taken, and then the splint is manufactured in silver,
Yeah, silver.
and so like a silver piece of jewelry, and then you wear it on your finger and it looks like a piece of silver jewelry on your hand. But they are extremely good. They stop the joint hyperextending or support for lateral stability, but they need to be very, very carefully measured. And then we send the measurements to America, and they're manufactured in America and shipped back to New Zealand.
I'm just sort of showing you, this is a
You'll need to go closer.
book. Can you see that? That doesn't fit me particularly. Silver ring.
Splint that looks 100% like a piece of jewelry. Yeah. And if they are measured well and applied to the appropriate instability, they're great. People love them.
And do splints work well for rheumatoid arthritis as well?
Absolutely. That's the short answer. Absolutely.
And Donna asks, what can she do to stabilize her wrist?
For me, I think of the rest of you looking at my hand, you've got horse's reins going in each direction. So the most stable position is when your wrist is straight down the line. So your middle knuckle being a reference and being straight down. So if you can think about loading it in the wrist straight position, that's the best way to think about it. So if you're too far over here, we're not going to go well. If we're too far over here, you're going to get too much pain. So trying to train it for stabilizing exercises in the straight position. And so we can teach you how to do that.
So wrist stability, like Lisa said, is about maintaining that middle position, not going either way. So a really nice way of being able to do that is with your TheraBand, you know, your elastic bands, is that you grip that band, and with your other hand, you try and pull as hard as you can, but your hand you're working on the wrist stability for has to hold in that position. And it has to hold. My hand's working really, really hard, the muscles of my hand and my wrist here, but no movement is occurring. That is a stabilizing or stability exercise. Really, really important. And you can do it simply by doing, you know, 1 potato, 2 potato, 3 potato, 4, you know. But if you put your hands on top of each other and maintain your wrists with no movement and push hard, and you get the resistance happening in each direction, and you hold this for 15 seconds, then relax, and then swap over, you have done a really nice stabilization exercise for your wrists.
Andrew says, is it possible to regain a range of motion in finger joints once the joint has degenerated?
That's a really hard question to answer.
It depends is the answer, I guess.
Yeah.
Yeah. So it's obviously worth trying, and we would absolutely try and give you some exercises that will help improve the range. And what we do in therapy is measure the range of motion and then give you the exercises. And in the session, we re-measure to see if it's actually going to work or not. Usually you can see a change within the session.
Yeah. So the whole thrust of caring for the joints and getting on to your exercises early and using your splints and assistive devices is that you can preserve the movement and the function as long as you possibly can. If you have a joint that is really painful, very swollen and stuck in a fixed position, then I would say that Your body is doing its job. So what your body does to solve the problem of an inflamed and worn out joint is your body fuses that joint in one position. And that's why many, many years ago, we can probably all remember old people who had quite deformed hands. We really don't see that degree of degeneration in people's joints and hands anymore because of the interventions that we're able to do, right through to surgical interventions where they're doing joint replacements of finger joints and thumb stabilization surgeries.
Louise says she wears a wrist splint, but it can make her wrist throb and feel sore. Is this simply because she's fastening it too tightly?
Quite possibly. It shouldn't make you feel sore. It should make it feel nice. Less pain. Less pain is the idea with splints.
Yeah, but sometimes you do need to take them off and do a little bit of movement, you know, like shoes, you know, shoes are great for your feet, but sometimes you get sick of the shoes, you need to take them off so your feet can, you know, have a change and then put them back on to go out walking and doing your jobs.
And when should you use the services of a physiotherapist or hand therapist in your arthritis journey?
Sooner rather than later, but definitely when you've got issues to come and chat about. So if you've got pain, if you've got swelling, if you've got stiffness, we definitely want to see you.
And how about someone who's been newly diagnosed, but they don't have maybe a lot of issues, or maybe it's been found in an X-ray when they've gone in for something else, and the doctor has said, "Oh, you've got arthritis here." Should they maybe go to a physio then to get some preventative strengthening exercises?
Your symptoms guide you. Your body's very, very clever, and your body will tell you when you're needing help. So what early arthritis looks like on an X-ray, and most people over the age of 35, you could find early signs of arthritis on an X-ray. It is a normal aging process in our body. I think when it becomes symptomatic and is impacting on your life, that's when you think, oh my God, I really need help with this. You know, if you love knitting and you can't knit because your thumbs hurt, go and see someone. You know, if you love riding your bike, but you know, your hands get so sore because you know, you've got some arthritis in there, go and see someone, there's no magic bullet, there's no solution, but there are ways to help manage the problems.
And so with psoriatic arthritis, sometimes people get what they call sausage fingers, and these can be quite painful. How would you decrease pain in that case?
Well, once again, it's managing those symptoms of the swelling and inflammation, gentle sustained compression. It's working with your medication. It's trying to pull together all the elements. You know, the therapy for hands is one part of that big picture. Your work setup, your medications, your rest, your nutrition, that all of those elements are all working together to give you the best possible function in your hands.
Definitely, we agree. And the medication with inflammatory type of arthritis, like psoriatic arthritis, is so key for minimizing your symptoms. So that can be a bit of a journey to get the medication right, but keep going back to your doctor if it's not working, and they can keep adjusting until you are more comfortable. It is 8 p.m. It is 8 p.m. Keep going forever, but we are going to stop now. So thank you everyone for coming along and thank you for your questions. Thank you for your insights. Thank you for your insights, both of you, Lisa and Gail. We can all go on and eat some dinner, or go to bed if we're tired. Or do some hand exercises before you go to bed.
Chucky too.